Welcome back, everyone. Today we've got eclass 1 for Module 4. So this is our last module with content from the book, and this is divided into two sections. So we've got chapters 11 and 12 for this e-class, and then 13 and 14 for the next e-class. And in these e-classes, we're just going to be briefly talking through what different aspects of social work practice look like. So in terms of the populations and the ways that we work with them. Your choose your own adventure activities will actually be directly related to these two e-classes, and that they focus on or provide you with examples of what practice can look like from actually practicing social workers. So again, these are two integrated to give you a better idea of what social work practice looks like in the real world. So as usual, we'll start with the overview. So we're going to cover the learning objectives for this class, review the key readings or key ideas from the readings that you should be familiar with, and we're going to talk about some of the different areas of practice. So we're going to start by talking about some of the common fields of practice and the different settings that social workers work in, and then we're going to talk more specifically about work with different populations. So we're going to talk about homelessness, employment, medical social work, clinical social work, and forensic social work. So again, we're going to talk about some of those key areas from the readings in today's e-class. So from your readings and through working through this e-class, I hope that you'll be able to identify different populations that social workers commonly work with and understand what practice can look like with these different populations in terms of the activities that we focus on with these different groups. So some of the key terms and concepts you should be familiar with from your reading at the end of these modules include relative and absolute poverty, the feminization of poverty, misperceptions about people who are poor, service responses to poverty, misconceptions about homelessness, risk factors for homelessness, and social workers' response to homelessness, unemployment benefits, services to people who are unemployed, restorative justice, social work's role in the criminal justice system, social work practice across different healthcare settings, the DSM-V or DSM-5, mental health, social work practice in mental health care settings, substance use, and social work practice and substance abuse prevention programs. So most of today's e-class and what you should get from the readings are really the different ways that social workers work with individuals and issues. And we'll talk a little bit more about that in the coming slides. So let's first start with a little discussion of the various populations that we work with. So in terms of populations, as you've seen through the examples in the textbook and our discussions, we work with individuals across the life course. So from infants through all the way to old age, to issues with death and dying. Social workers are involved in really every aspect of life and working with individuals. And as you've seen through our case examples, we are also involved with working with families, groups, for example, the support groups that we talked about in the last e-class. We also get involved in legislative and policy actions as well that are directly related to the different populations and issues that we work with. And you see a lot of overlap potentially between the populations and the issues that we work with and on. So social workers are involved in helping individuals, families, groups, communities, and society overall address a number of issues. So this could be in terms of addiction, substance use. For example, in terms of aging, we're actively involved in trying to help older adults access the services and resources that they need to live in their homes. We may also be working with those older adults around bereavement, grief and loss in their families in preparation for the death of the older adult. We may also be involved across the life course, really, with issues of death and dying. We, at the community level, we get involved with community development. So we may be working with nonprofit organizations as consultants. We may be running our own nonprofit organization that seeks to develop the community. We may also be involved in activities around crime and victimization, and we'll talk a little bit more about the growing field of forensic social work here later in this talk. We're also very involved in terms of helping individuals and families get access to the resources that they need to live happy and healthy lives. And so this includes, helping them access resources to get out of homelessness, helping address issues of poverty, helping them with employment opportunities, and things like that. And we'll see this a little bit more as we talk about some specific areas of social work practice. So the areas of practice that we're going to talk about a little bit more in depth today are case management and support for individuals who are experiencing homelessness. This is individuals and families working around employment and occupational opportunities with individuals, the work that social workers do in medical and healthcare settings, what clinical social work can look like, as well as forensic social work. So one of the areas that social workers are working to address is the topic of homelessness, or those who are experiencing homelessness. And so a lot of what we do works around helping individuals and families access affordable and adequate housing. We tend to advocate for housing subsidies, so trying to help individuals access subsidies so that they can afford various housing opportunities, as well as advocating on a higher level to try to increase the number of housing subsidies and the amounts that are available. We also work in terms of strengthening the continuum of housing, income assistance, and income support services. So often, as we talked about way back in the earlier modules, systems are fragmented. And without a continuum or a holistic framework for helping individuals access not only housing but income assistance, as well as such things as like employment opportunities, without all of these aspects being integrated, it's very easy for people to fall through the cracks. So for example, even if we help them access housing through a program such as Housing First, if we don't have in place supports in terms of income assistance, whether they be on disability, unemployment, or other aspects, they're not going to be able to pay the rent for that housing, and which is just going to cycle them back into being homeless again. And so social workers really work, again, with that taking a holistic view of the person and their circumstances and understanding all the different pieces that need to come together in order to fully support this person. Now, we also work on prevention programs, and this could be in terms of substance use. This could be in terms of working with the VA on helping them develop better programs to support veterans, since veterans, particularly male veterans, have a high risk of homelessness after returning from service. These are ways that we can work to address issues before homelessness happens. And then finally, we can also work kind of on the larger, again, advocacy legislative side to promote the idea of living wage policies. So ensuring that people who are working are adequately compensated for their work, and that this compensation is adequate for paying for housing, food, and other necessities. A common misconception of homelessness is that individuals who are homeless are unemployed. But actually, about 20% of those who are homeless are employed, And what this means is really that we have an issue in terms of employment and income being adequate to meet the basic needs of individuals and families in terms of paying for housing, food, and other necessities. Now, if you think about it, particularly with the Great Recession that we just went through, it's if you're already in, financially precarious situation, or even if you're not, even if you're on, say, the lower end of the wealth spectrum, you're, middle class, but you don't have a ton of wealth or resources. Particular shocks like health shocks, especially if you don't have health insurance, um, income shocks like losing your job, um, other types of issues such as having to take on or take in a relative, things like this can all push people into homelessness, right? So there are actually, people who are working and employed, but they don't have the enough income and wealth or enough stability in terms of these areas to be able to not only afford housing, but to be able to weather storms such as health shocks. And one of the areas that's growing in social work is actually around the idea of developing assets. Because remember, income is important, but so is wealth. And by wealth, I mean access to resources. So owning a home would be part of your wealth, a vehicle, any stocks, bonds, or savings accounts, things like that. Those are all aspects of wealth. And while there's a big income divide in our country, the wealth gap is actually substantially larger. There are far too many people who don't own their own homes, who don't own vehicles, who don't have these kind of resources that they can fall back on and draw money from if they run into a crisis. And that's part of why it's important to understand that homelessness, while there's often the picture in the United States of, homeless individuals being drug addicts or things like that. Homelessness is a very complex issue. It impacts people across the life course in various circumstances. And there are things that social workers are actively involved in, particularly in what's listed here, as ways to try to help individuals and families access those resources they need to become more stable in terms of their income and maybe be able to um, develop some assets and wealth so that they can weather any future storms. So I mentioned employment in the last slide, and social workers are involved in helping individuals in terms of employment and occupation and issues of underemployment in a number of ways. So for example, we may be involved with various populations and helping to develop their employment skills. So we may be working with individuals with disabilities, be they physical, cognitive, or sensory, and we helping them develop skills, helping link and connect them with jobs and things like that. We may also be working with individuals who have a history of substance use, and helping them to access first supports to help with their substance use, and then also to transition back into the employment sector. We may work with them around skill development as well. We may also be working with individuals who've experienced domestic violence, single parents, and helping them to access resources, be it childcare, therapy, and things like that, helping them gain skill sets to transition into new jobs. We might be involved with anything from helping with CV development, resume development, to practice interviewing and things like that. Now, on a bigger level, we work with corporations in terms of consultancy to understand how to better support and motivate their employees. We also, on an advocacy level, may be involved with unions, helping them develop, supporting them, helping them access the resources they need, or to develop coalitions of organizations and things like that. So one of the really big areas of social work, this is kind of an umbrella term, is medical social work. And social workers are involved in a wide variety of healthcare settings. For example, they may be working and in terms of schools and working with the nurses in the schools. They may be involved in outpatient or inpatient rehabilitation services and programs. They may be working at hospitals as intake and discharge planners. They may be involved in working in nursing homes and hospice care as well. So really the range of opportunities in terms of being a healthcare professional as a social worker are vast. There are so many opportunities and different populations to work with, different areas to specialize in, or different issues, if you will, to specialize in. For example, substance use, mental health, disability, just general health care, and things like that. And so some of the things that social workers do in terms of their roles include intake and analysis, along with a team of nurses or doctors. They may be helping to coordinate services for home care following a discharge. So, for example, as older adults discharge out of the hospital, they may need various services and supports to help them get to their primary care physician. They may need help understanding what medications they need to take, how to take them, getting a minder set up, and things like that. And social workers are involved in those kinds of activities. Now, social workers may also be involved in terms of making referrals to rehabilitation and long-term care facilities. So, for example, one of my good friends who is a social worker at a hospital, she does intake and referral that transitions people from the hospital setting into short-term or long-term mental health care facilities. Social workers may also be involved in outpatient settings, right? So, in terms of individuals coming to seek services, whether it be a healthcare clinic, whether it be for substance use, mental health, things like that. Social workers may be involved in referral services, connecting those individuals with supports. They may also be involved in counseling. And so individuals who need more assistance in terms of navigating their particular issue or crisis, social workers may be involved with that. And particularly in hospital settings, social workers are a key part of the interdisciplinary team. They present cases, work with the doctors and nurses directly to develop the care plan for individuals, to help make sure that all the resources are in place for the individual when they transition out of the hospital, and various other aspects of that. Another really good example of interdisciplinary work where social workers are really deeply involved in the process are the PACE programs. So these are programs for all-inclusive care for the elderly, and they're essentially a day program where older adults are brought in. Either they have their own transportation, a family member brings them, or the organization vans go out and bring them in. And it's a day service, so they are provided with socialization opportunities. Nurses are on staff, so they see the nurses to monitor their blood pressure, check their medications, things like that. And the social workers run all of the activities from, the social programs. They might provide reminiscence groups or grief support groups. They would also be then involved in terms of referral and services, so making sure that the older adult has the services they need when they leave for the day to support them through the night so that they can come back in the next day, and so on and so forth. So related to the medical social work is clinical social work. And so this is more specifically focusing on the mental health services that social workers provide and are involved in. So social workers, particularly those who have their own private practice, may be involved specifically in terms of doing assessments, diagnosis, and treatment. So they may be involved in doing counseling, one-on-one groups or family counseling. They use a variety of therapeutic techniques for this. And so for those of you who are going to stay with social work, you may go on through your master's program and ongoing training and education to specialize in various therapeutic techniques. When appropriate, they also provide referral and case management for different supports and services. They may do home assessments to make sure that the clients have what they need in their home. They might provide some initial counseling and then help them get involved as well with a grief support group or some other kind of support group to help them work through whatever issues they're experiencing. And then one of the more difficult parts of clinical social work, particularly if you own your own private practice, is dealing with healthcare insurance. So individuals who have their own practice, and we talked about this a bit with my aunt in previous classes, is the need to be able to bill for the services provided. So clinical social workers, not only do they have to have those good interpersonal skills, they have to have the training in terms of specializing in various therapeutic techniques. They also have to have an understanding of the macro level in terms of the healthcare policies, how to negotiate that, how to take care of the billing, how to manage staff if they try to grow their agency, and things like that. So another big or broad area of social work is forensic social work. And so it deals with social workers who are involved or working with the criminal justice system in some way. So social workers may be involved in terms of being employed by the courts, working for nonprofits, or they may even have their own practice. And they may be involved in doing risk assessments. They may be involved in doing assessment and treatment plans. They may be providing mental health support and services. They may be making referrals. For example, individuals or families who have substance use who come to the court, making sure that they are referred to appropriate programs to help them get sober. They may also be involved in terms of actually providing the various supports and therapies or running the programs for the individuals in the criminal justice system. On a more macro level, or I guess more meso and macro level, social workers may be involved in terms of either developing or running programs to support victims of trauma or abuse. They may be running nonprofits for individuals who are victims of domestic violence, helping to support them, then helping all the way through the process of then testifying against the offender. They may also be involved in mediation programs. So for example, between the victim and the offender. They may also be involved in restorative justice programs. So programs to help those who've been convicted of crimes to make amends, or at least start to make amends for the crimes that they've committed against the people that they've hurt. They may also be involved in terms of helping to individuals as they come out of prison to avoid reincarceration. So they may run programs in the community. They may run support programs and things like that to try to help reduce recidivism. Social workers may also be involved in advocacy efforts, for example, around abolishing the death penalty, trying to get rid of isolation in prisons and things like that. And they may, this could be on the local level, this may be on the state level, as well as on a federal level in terms of lobbying for efforts. For example, social workers are heavily involved in trying to break up the school to prison pipeline. So they may be developing programs in schools such as meditation programs instead of suspension. They may be involved in advocating and working with DAs to come up with alternative punishments instead of getting the kids right into the systems. So social workers are really involved in a wide array of activities when it comes to the criminal justice system. And this is an area that's really starting to grow in social work. And so for those of you who are interested in working, whether it be with victims of crimes or abuse or with the perpetrators, forensic social work, again, it's a growing area. It's a great area to get into, as this is a major issue within our country. We incarcerate so much of our population compared to other industrialized countries. And so the more social workers who are involved in terms of helping to adjust the system, to stop that school to prison pipeline and things like that, the better. So again, social workers involved in a wide variety of areas in this field. Okay, so that's the end of the e-class, this first e-class in Module 4. So up next, make sure you complete the special topic e-class and the self-assessments, and complete your milestone check-in. If you haven't already, start working on those call to action projects.